Hi everybody, welcome at the ECNP Congress Daily again. We are again sitting at the ECNP venue in Vienna, and it's the third day of the Congress. I'm sitting here with three lovely guests again. I will shortly introduce to you. Sitting next to me is Anna Beyeler. She's assistant professor at INSERM, University of Bordeaux. And her research focuses on the role of neural populations of the insular cortex in emotional valence and anxiety, and she uses technologies at the forefront of circuit neuroscience. And next to her is sitting Christina Dalla. She's associate professor of psychopharmacology at the Department of Pharmacology Medical School and National and Capodaustrian, it's difficult to pronounce, University of Athens, and she has almost 20 years of research experience in psychopharmacology, specifically on sex differences in animal models of depression, cognition, and Alzheimer's disease. And she does screening of CNS-acting compounds and neurobiological studies. And third, last but not least, is sitting Dr. Damiaan. He's professor and chair of the Department of Psychiatry at the Academic Medical Center, University Medical Center. And he is, as a scientist, he is well known for his research on OCD, anxiety, and for the development of deep brain stimulation for psychiatric disorders. And his work is also characterized by a very multidisciplinary approach, making use of psychiatry, philosophy, and neuroscience. Welcome all. Thank you for accepting the invitation and for being here tonight to talk about the highlights of the conference and also look what are still highlights that are yet to come tomorrow. Yes. Yeah. How are you enjoying the Congress so far?
Well, thank you for having us. For me, it has been really a pleasure. We didn't have so many meetings over the last years, so it's my first ECNP meeting. I've been going to the American College of Neuropsychopharmacology, and it's the first European one, and I'm really enjoying it, and especially this translational between preclinical and clinical research is very valuable in our daily work, and I think for the patients in the future.
Happy to hear that. Yeah.
Yes, I think it's an amazing conference. I have been to almost all of them, but I think this is one of the best. And
what makes it one of the best?
I like a lot this translating approach that we have, also the preclinical and clinical, and all the educational sessions, the posters, everything that it's more oriented to students, more interactive also with the hybrid format.
Yeah.
So I think it's very good. The size is also good. The venue is beautiful.
Yeah. It's the second year that it's in this hybrid format as well.
I prefer it. Yes.
Yeah, you prefer it?
I like it a lot. Yes.
Yeah. What do you think of it, Damiaan?
Well, I think it's more costly. It's more sophisticated. Yeah. So it's a huge investment, but I think it's worthwhile. I'm so glad that the ECNP already, very fast decided to do a live conference. There was last year one in Portugal, and this one is now in Vienna. So I hope that they go on. And I think the hybrid thing, well, it gives people the possibility, if you live far away, to enjoy as well the conference. So it's a very nice concept, but it's much more complicated, I think.
Yes,
well, I would say it's even better for the people that are here, because when you have like two very good sessions in parallel, you can actually watch in the evening the one that you missed, so there is less fear of missing out. No, I actually have done that, so I watched the hot topics, not during the hot topics, but it was actually a good session that I recommend people to watch afterwards.
Yeah, good.
There was especially, if I can say that, one talk on social cognition that was very interesting, with the preclinical circuit dissection and also a little bit of human data. That was really interesting.
Yeah, good. Yeah, and good that you mentioned it indeed. And I think it's the videos are even available until January. So all the time in the world to rewatch the sessions.
Very useful.
Yeah,
it's very good.
Yeah. Any other highlights of the things you've seen so far?
Yeah, I loved all the symposiums about that we're having more now lately about the postpartum and pregnancy and more about gonadal hormones and women and how we can treat women also in different stages. And there was one yesterday about the premenstrual dysphoric syndrome that I think it was very, very good, and postpartum depression. And so it brings new concepts and new ideas and therapeutic approaches. And today there was one for this morning for pregnancy and postpartum again. So I think it combines very well.
Yeah.
And there are also more things on sex and gender. So I think this is a very good approach that we should continue having.
Yeah. Yeah, sounds interesting.
She was actually chairing just before that a session on sex differences in clinical and preclinical studies that I went to, and I recommend it also. It was very interesting.
Yeah. What were the take-home messages? Do you remember?
Well, there are many, but I guess that we should be more careful and include female in preclinical studies and be mindful of treatments and doses of treatments in humans that can be different in men and women.
Very
I don't know,
important.
you should have asked her. She's
No,
the expert.
it's an educational session, so I think it was the fourth one. There is more tomorrow. And so they're bigger, the talks are longer, but they give some tips also on methods and how to analyze results. So I think it's very useful, especially for students, but also for PIs. I think it's useful for everybody. Yeah. It was good that it had also clinical aspect, but as well as preclinical.
Yeah, and a very important message, I think, to everybody working clinically and doing research in patients, that we should really also include more women to know, like,
Yes, and analyze also our data by sex and gender.
Exactly.
And yesterday there was another educational on anxiety and depression, which was treatment.
With the Katarina
very-
Damschke.
yes,
Yeah, this was a
yes,
very
and
good one
David
too. Yeah,
Van
I really enjoyed it. It
was very good.
One of my top sessions as well.
Yes.
Yeah.
Yes, I think they're all. I'm a member of the educational committee, but so we make a very much effort to really select useful stuff that they can be.
Yeah. What's the difference between the normal sessions and the educational sessions?
Yeah, the normal are mostly about presenting data and new ideas. And the educational ones, they have questions for the audience. So they have the Slido questions with multiple choice answers. And they're more educational. So we're there to learn things. They are longer, the talks are longer.
Yeah, there's more bigger introduction.
Yes.
I think for example, for the anxiety one, it was clinicians, but there was a longer introduction. So as a non-clinician, it was very interesting to have all this background that generally when people present data, they just directly jump in the data.
Yes, it's also giving more an overview
of the current state of the field.
And interactive.
It's interactive, and we choose speakers that they are experts in the field, but they don't necessarily talk about their own data. They talk about this research area and how we can approach it. So I think it works well.
Amazing.
I like it, yes.
And Damiaan, you were moderating the ECNP Got Talent.
Yeah.
I think many listeners who haven't been there maybe think, what is that?
So it was a challenge. Some people were asked to send in small movie clips of them presenting their material. And it's interesting because there was a jury, and we judged, of course, the research, the quality, but as well the presentation skills and the originality of the movie. And that's interesting because it gives another angle, and you can really see that they made a lot of effort to make it much more beautiful and interesting. So
to sell the science.
To sell the science in a more attractive, appealing way, not the typical boring, but with a lot of images and sketches, and they did very well.
Very creative.
It was very nice. Yeah.
So did you select a winner already?
Yeah, we did. Yeah.
I need to
And
check
the winner got a sketchbook eventually. So.
Nice.
Yeah.
Yeah. And I think this year was the first time that people had to pre-record a video. Last year it was
Live?
presentations, like live presentations.
Yeah.
What did you think of this new concept?
It has advantages and disadvantages. I think that if you present lively, there is a stress factor that makes it more difficult, but as well makes it more attractive for some people, those who have more skills to present lively. If you have more presentation skills in terms of working with movie clips and so on, then it expresses itself in a nicer movie. So there are two different styles.
Yes. Yeah.
And maybe next time we should combine them or have both of them. Yeah. But the jury thing and the kind of competitive way, that makes it very fascinating.
Yes. Yeah. I'm gonna rewatch that one
that's
as
good.
well. Yeah. And Anna, you've also been chairing a session on the ALBA network.
Yes, so
What-
yesterday,
yeah.
so the ALBA network is a network that has been launched in 2019 to support diversity and equity and inclusion in neuroscience and brain science in general. And so if you are interested, you can watch the session. You can also directly go on the website, which is very well done, and you can register as a member and find all the information. But yeah, it has been very interesting. We had a very interesting discussion. The people were quite engaged, and well, the conclusion is there's still a lot of work to do.
Yeah.
And the specific topic that we touched on was the diversity in prize nomination, and the take-home message that was that the proportion of nominators, of people that nominate, is then reflected in the proportion of winners in terms of gender, but we believe it might also be the case in terms of other diversities, including ethnicity, disabilities, country of origin. So the message is that if you are from an underrepresented group, you should also nominate who you think deserve prizes.
Yes. Yeah. Very important topic, and still a long way to
Yeah,
go.
but it's going in the right direction. But we need more people engaged and advocating for these things.
Great that you've chaired that session.
No, it was very exciting, and we had like really great people with us. We also had the chair of the ECNP Award Committee that was there, and Bita, who was Mogadam, who was the opening lecture of the whole conference, and two other members of the board of directors of ALBA. So it was a great session.
Yeah, good meetup.
And there will be another one, hopefully, at the next ECNP meeting.
Yes,
If you want to see
next
another
year.
live one.
Yeah, definitely. Yeah. And any other things that you've seen that you would like to recommend?
Well, it's something that was close, but I think it's interesting. I was at the editorial board meeting of Neuroscience Applied, which is the new journal of the ECNP, and it will take off. So next year it will be on PubMed, and it's kind of exciting when it's completely
very
new.
exciting.
It's an open access journal with a wonderful editorial board. So it's interesting to be part of it, of the back, what happens, how to organize it. So that's something that we will launch next year, and it's a wonderful opportunity for all of us to send in our papers.
So is it going to be mensual or like every month or monthly? Sorry.
I'm not sure.
Or annual journal?
It's an open access journal, so I
So
don't know
it's
how
gonna
it
be
really works. I
with
think
the
it's
flow,
ongoing.
I see.
So
Yeah.
and and it's part of the ECNP. So.
Yeah, and what's the difference between like the old journal and this new neuroscience journal?
It's new in the sense that it's an open access journal. It has a new format. The title is a bit different. It's Neuroscience Applied, which is the subtitle of the conference or the Congress in the latest years. It's broader in that sense.
Yeah.
The older one was much more focused on psychopharmacology, although it was bigger and greater and broader than that. This one is neuroscience applied in its great diversity.
Yeah, so it's targeting a broader spectrum of studies. Yeah, great. Yeah. And of course, it's already the third day, so only one day left. But do you have any things on your to-do list for tomorrow? Any things that you want to see?
There is a very good plenary tomorrow, again, about perinatal health, brain health, of course. There are also many meetings about the ECNP networks that people can join, about different specialized network activities. And there are also these sessions about the Love Your Brain that I liked a lot.
Yes.
Today there was one actually here at Room K. That was really good. It was about brain fog.
Yes, I've seen that one as well.
Yes, so
It's
it
really
was,
interesting.
it was for the general public. The talk was simple, but it was really appealing and very interesting. So I really enjoyed it. I recommend it.
Yeah, also from a very personal perspective,
Yes.
which made it also
Yes,
interesting.
Yes.
Yes.
Speaking of sessions that I really liked, the poster jam, I had never attended these types of sessions, so it's 3 people presenting in 3 minutes their poster, like to a small crowd, and I thought it was a nice teaser, and then you can have kind of an overview of a topic. There was one on stress and anxiety today. I forgot what it was. It's going to be tomorrow, but I would recommend to try to attend these if it's on a topic that you're interested in.
Yes, there are many more poster jams than last year. as
Yeah,
well,
yeah,
I think.
exactly,
It's a
yeah.
really,
And the campfires are also.
Yes.
The campfires,
yeah,
People are trying to get in.
definitely.
one
Yeah,
for-
some were really crowded.
There was one for media and misconceptions in neuroscience, and it was very good.
And I was at a meeting for regulators, which I thought would be very boring in a way, but it was fascinating. It was the topic was quality of life. So how can we include new outcome measures when we test drugs or any other in treatment, and what kinds of quality of life measures can you use, like for example patient participation, how does the patient feel, and that's interesting because it's like a new way of seeing how psychiatry develops, not just focus on the symptoms but much broader. What does it change, how does it change your life, your personality, and so on.
Yeah.
And I think it's the same for neurology. It's not only psychiatry.
Sure,
The
yeah,
quality
it's
of
a
life,
discipline,
yes,
but I
it's,
think in psychiatry is still new. It's
Yes,
hard to
in a way,
develop the
yes.
new quality of life
Yes.
measures. What is the end point? Is it happiness? Is it autonomy? Is it freedom? Is it being yourself? So how would you define it?
Yes, it's
Yeah.
Speaking about patient, there was in the first day there was a session with meeting the patients, and I thought that was very interesting from a preclinical researcher point of view, because I rarely interact with patients, and they were sharing experiences on the treatment, different types of treatment, and what has been working and not working for them, and that has been very interesting.
Really
and
interesting.
yeah, it's the first time
Yeah.
in a conference that I've seen that, and I really thought it was interesting.
Yes, that one is probably not recorded if it
I'm not
included
sure.
patients or.
I don't know.
Yeah,
We would
we'll
need to
see.
check.
Yeah, no, but indeed, really good that they do that, especially because ECNP
good,
is
yeah.
about connecting
Helping the patient,
preclinical,
yeah.
also and clinical scientists. Yeah,
Yeah.
nice. Yeah. Any topics that you would like to see more of next year that are already here, or any completely different topics that you missed this year?
I think the food topic is an issue. You had to be on time to have enough food.
Oh yes, yeah.
Not the food research, like the food for the scientists.
So the nutritional
true.
topic was present.
I had only a pretzel today.
Yeah. Yesterday I
fine.
missed everything. So but
Yeah, well, at least we won't gain weight. And
no,
Yeah,
that's
no,
true.
but the food
Yeah.
that was there
To
was really
compensate
good.
the schnitzel of the
Yes.
evening.
Yes,
There will be more about long COVID. I think there is one tomorrow, but
Okay.
next year I
Yeah.
think there will be more, and the year after.
Yeah, good
About
suggestion.
long COVID and brain
Yeah.
health, that's a big issue. Also digital tools, how we can use them in research, and especially in clinical practice.
Yeah.
There was one
Definitely.
session on the preclinical side, and there was also one clinician at the end for with the artificial intelligence to dissect behaviors in mice and humans, and that has been also interesting.
great.
And hopefully there will be more. That has been. It was a symposium, but yeah, hopefully
Yeah.
that. I would like to see more of that.
Yeah, well, good suggestions. Who knows next year? Yeah, well, thank you for
Yes.
being here, for the interesting conversation, and enjoy the last day.
Thank you.
tomorrow.
Thank you.
Thank you.
Well,
Thank you very much.
And
for having us.
the people at home also enjoy the last day at the conference. See you next year, hopefully.
Bye-bye.
Bye.
Bye.